The world's second largest economy is on track toward a strong start of its 15th five-year plan, eyeing homegrown advanced tech innovation, deepening reform, and expanding high-standard opening up. So how can the Chinese economy fully benefit from these measures? How can China tap into the potential of the three tools for growth: fiscal policy, monetary policy, and structural reforms? My in-depth interview with CPPCC member Professor Bai Chong-En, the Dean of the School of Economics and Management with Tsinghua University. The school has nurtured generations of policymakers in China over the decades. You have been arguing from last year that both the fiscal and the monetary policy of China should support reform and, as a result, to promote the transformation of the economy. Tell me more about exactly that can be done.
Okay. When we talk about economic policies, normally people divide policies into three areas: monetary policy, fiscal policy, and structural reforms. And then the issue is how to connect them together. And in the current situation in China, I think it's very important to put them together. For example, we have one of the problems we face is that prices are weak, and we have negative price growth in the last few years. This is actually a big problem. When enterprises decide whether they want to make investment or not, or how much investment they make, future price prospects is an important factor to consider. For consumers, whether they want to consume or not, nominal income is very important. If you tell them that your income grew by 2%, but price dropped by 2%, then you tell them that your real purchasing power by 4%. People don't feel that. They look at their nominal income. So when price grows in a healthy way, consumers' nominal income grows as well. And also for durable goods, if they expect the price to drop, they don't want to purchase now, they want to wait. So price movement affects consumption as well. One of the very important sectors in China is real estate. And it used to be a very big part of the economy, but now it's not doing well. And the most important factor that affects that sector is the price movement. If consumers, if investors expect the price to drop, they're not going to buy. So price movement is so important. Any policy consideration will have to take this into account. So this is one thing. I think in the next 5 years, we need to do something about the prices. At the same time, we also have a lot of structural reforms that should be done. For example, our consumption as a share of GDP is still low. There are disputes about how low it is. There are different numbers, but overall, it's still low. And if you compare Chinese household consumption with that of a more advanced economy or more advanced economies, you find that services consumption is relatively weak. And a lot of the service consumptions are semi-public goods. For example, health. Consumers take money out of their own pocket, they purchase health services. But a lot of the expenses are covered by the health insurance programs. So it's partly market-driven, partly affected by policies. Education, obviously, is another thing. So a lot of important areas where Chinese household consumption falls short are these areas where it falls. Are these areas which fall between the government and the market. Policy, they are very policy sensitive. So in order to boost consumption, boost spending in those areas, we need to reform the policy. Let me give you an example about health. We have at least 2 different health programs. One health insurance is employment-based. We are all covered by this. If you are working for an institution, for an organization, you are sort of covered under the health insurance system. The other is the so-called residence health insurance. People who are not formally employed, the government offers this residence health insurance program. So this employment-based program and this residence program are very different. They offer different benefits, and you also pay differently. And one of our problems with the health system is that the residents' health insurance is much weaker than the employees' health insurance. And the employees' health insurance covers about less than 400 million people. The residence program covers more than 900 million people, about 1 billion. And this 1 billion people is not given very strong health coverage. So that's an important factor that affects the development of the health sector. Then the issue is, how do you deal with this? Right. So there are proposals to merge these 2 programs, which is really difficult because for employment-based program, fundraising is easy. You just deduct it from people's payroll. But for residence program, people need to take money out of their pocket. You cannot force, it's not mandatory. So different financing schemes make it very difficult to merge them. But I'm doing some research there. We can design a way so that eventually they merge.
It seems that you are suggesting that people should be more willing to spend if the prices are going higher. And you're also suggesting that there are certain policies that can be done to encourage people to take out more money.
This health insurance program needs to be reformed. We have a design so that eventually they can be merged, but it will take a transitional period of time for that to be realized. In the interim period, you don't have the fundraising. Just the fundraising part has to take time to build up. And so you need money to support the improvement of the health insurance program. And where does the money come from?
That's the key question.
Yeah, that's the key question. And the idea is that when prices are weak, there is a lot of capacity for the government to issue bond, to borrow. When the prices are weak, when government borrows, there is no risk of creating high inflation. If the price movement is normal, suppose we have 2% inflation. If government borrows too much and spend the money, then it can overheat the economy and create inflation.
So you're arguing this is the best time to do it?
Yeah, this is the best time to do it. Prices are weak. There is a lot of capacity for the government to borrow without creating inflation. And when the government borrows, if the monetary authority doesn't cooperate, it can create a lot of problems. So it takes very good coordination between fiscal and monetary policy to make it easier for the government to borrow, to lower the cost of government borrowing, and use the money to pay for the transitional cost of the reform of the health insurance system.
You even argue, using an analogy, this is almost like a free lunch. Professor, how to make sure it can be a sustainable free lunch?
Yeah, that's very important. You have to have deep reform of the health insurance system so that in the long run, they are self-sustainable. Fundraising has to be enough to cover the expenses. So in the longer run, we should have this system in place, which is fiscally sustainable. And the program I suggested only pays for the transitional cost. So if you rely on this fiscal and monetary support stimulus forever, that will be a huge problem. In the future, when prices become normal, it will create inflation, etc. So that's what I call investing for reforms. You have to have the reform. Otherwise, you spend the money and then you can create dependency. So suppose now you improve the benefits, but in the future you cannot afford to do it, but you have to do it because people become dependent on it.
How long is the so-called interim period?
Yeah,
and how is it related to the prospect of China's economic growth, meaning the money can be supporting the overall transition that you just argued about?
You have to do it, to design the whole process in a way that you always watch for the reactions. You tailor the pace of the reform according to the data, according to the reaction. So it's going to be difficult, but it's the right direction, I think. And it's doable. In other countries, people experimented with different things. We learn a lot from those experiments. But in a lot of those cases, they don't consider monetary policy, fiscal policy, and structural reforms comprehensively. So my proposal is to put them together, consider the whole package.
You even argue back in the late 1990s that there were similar practices done by the Chinese government. Of course, the economy size at that time cannot be compared to what it is today. And by the way, there was tremendous pain and challenge at that time when the policy was being implemented.
Right. I'm glad you mentioned the late 90s and early 2000s case. At that time, Chinese commercial banks were laden with a lot of non-performing loans. It was a high ratio, and people were very concerned about the soundness of the financial system. Then the Asian financial crisis just happened, so we were very apprehensive of the possible crisis in the Chinese financial sector. So at that time, if we don't do something about the non-performing loans of the commercial banks, the economy will be stuck, because when they are burdened with so much non-performing loan, they will not be very active to issue new loans. So you have to solve that problem. But to solve that problem, one solution is to pour money into the bank. Then the risk is when you solve the current non-performing loans, new non-performing loans will come.
And they piled up.
Yeah, it will be piled up. So this is the so-called moral hazard problem. When you help people, they become reliant.